research indicates that regular aspirin intake can significantly lower colorectal cancer risk in people with high lifestyle-related risk factors. Among men and women followed for more than 30 years, those with less healthy lifestyles had the greatest benefit from regular aspirin use, according to a Mass General Brigham-led study. Regular aspirin may help lower the risk of colorectal cancer in people with greater lifestyle-related risk factors for the disease. The study, published today in JAMA Oncology, could encourage a more nuanced approach to preventive aspirin use. Researchers sought to identify individuals who are more likely to benefit from aspirin to facilitate more personalized prevention strategies. Colorectal cancer is the second leading cause of cancer death in the United States, according to the National Cancer Institute. The U.S. Preventive Services Task Force previously recommended daily low-dose aspirin to prevent cardiovascular events and colorectal cancer in all adults ages 50 to 59, the highest risk age group for colorectal cancer. In 2016, they withdrew the recommendation in part due to concerns about aspirin increasing the risk of gastrointestinal bleeding. For the study, researchers analyzed the health data from 107,655 participants from the Nurses' Health Study and Health Professionals Follow-up Study. They compared the colorectal cancer rates in those who took aspirin regularly with those who did not take aspirin regularly. Regular aspirin use was defined as either 2 or more standard dose 325 mg tablets per week or daily low-dose 81 mg aspirin. The benefit of aspirin was largest among those with the unhealthiest lifestyles. Those with the lowest healthy lifestyle scores had a 3.4% chance of getting colorectal cancer if they did not take regular aspirin, and a 2.12% chance of getting colorectal cancer if they took aspirin regularly. By contrast, in those with the highest healthy lifestyle scores, the colorectal cancer rates were 1.5% in regular aspirin taking group and 1.6% in the non-regular aspirin group. This means that in the least healthy group, treating 78 patients with aspirin would prevent 1 case of colorectal cancer over a 10-year period, while it would take treating 909 patients to prevent 1 case for the healthiest group. Lifestyle scores were calculated based on body mass index, frequency of cigarette and alcohol use, physical activity, and adherence to a high-quality diet. These results showed that aspirin can proportionally lower the markedly elevated risk in those with multiple risk factors for colorectal cancer. In contrast, those with a healthier lifestyle have a lower baseline risk of colorectal cancer, and therefore their benefit from aspirin was still evident, albeit less pronounced. One outcome of the study could be that healthcare providers might more strongly consider recommending aspirin to patients who have less healthy lifestyles. While the study included those who took regular standard dose 325 mg aspirin 2 times a week in the regular aspirin using category, based on prior studies, the best evidence supports daily low-dose 81 mg aspirin for prevention. Previous studies have found evidence to suggest aspirin can reduce the production of pro-inflammatory proteins, known as prostaglandins, that can promote the development of cancer. Aspirin may also block signaling pathways that cause cells to grow out of control, influence the immune response against cancer cells, and block the development of blood vessels that supply nutrients to cancer cells. Aspirin likely prevents colorectal cancer through multiple mechanisms. The study did not assess potential side effects of daily aspirin use, such as bleeding. In addition, while the study tried to control for a wide range of risk factors for colorectal cancer, in comparing non-aspirin and aspirin-taking groups with the same level of risk factors, because this was an observational study, it is possible there may have been additional factors that influenced the findings. Thank you for watching. If you've enjoyed our videos, subscribe to our channel for there's more to come.